So before this took over my life, I'd worked in the NHS for over 40 years as a pharmacist, and I also spent the last 10 years of my life in the NHS working on quality improvement. We tried to make things better for our patients. Before lockdown, life was wonderful. I'd see my mum every day. I'd be there for up to 3 hours, and we'd watch the same episodes of NCIS every day because we loved Gibbs and what was going on. And we would talk, Mum would talk to me. At times she would shut her eyes and I'd say, "Go on, Mum, open your lovely eyes so I can see you." And she would say she was listening, not always watching, but she was listening. But she was eating well and she ate herself. I'd just prompt with drinks. But yes, life was wonderful. And then we had lockdown. And again, that was okay because I knew it was time limited and everybody was in lockdown. So I tried to keep in touch with her by the phone. It was difficult because she can't hear very well, but we managed. But I think it really hit me when lockdown finished for the majority of people. So we were expecting life to get back to normal. And it was then the care home said I could only have one 20-minute visit every 2 weeks. So to go from seeing my mum every day to 20 minutes every 2 weeks was atrocious. And often, because mum's got dementia and she can't see very well, she can't hear very well, touch was everything. So I was forever stroking her cheek and holding her hand. And she responded well to that and she'd smile at me. And when I said, "Are you glad that I'd come to visit?" she said, "Oh yes." So that was great before. But then we were separated, so it was a 2-metre distance. So she has glaucoma and cataracts. So 2 metres away, she could hardly see me. She's got hearing aids, she could hardly hear me. So from then on, I was fighting with the home to see if I could have closer visits, because the NHS guidance says that if you've got somebody with dementia or who can't hear, see, talk properly, then close contact was allowed. But the home wouldn't let me. I was too much of a risk. I came up with lots of suggestions of things we could do, and I could enter through her room, but they wouldn't even let me walk across the grass. And this was at a time when we had no COVID locally, but they wouldn't even let me stand outside her window. So seeing her 20 minutes every 2 weeks, it was torture. We were a very close family. I'd speak to her every night before she went to bed just to make sure she was all right and keep that contact going and that stimulation, which is so important for somebody with dementia. After Christmas, Mum collapsed and the doctor came and he said that she was end of life. She's got an abdominal aortic aneurysm. That could burst any time, and we'd been living with that for 2 years, and if that bursts, she will die. So she was in agony. I went to the pharmacy to pick up some medication for her, but they had 2 ambulances come out to her, and then they had the on-call doctor, and he said she is end of life. Now, as soon as you're end of life, NHS guidance says you should have free access. She'd been end of life all the time, but the GP wouldn't agree she'd been end of life. So there's a lot of argument about definitions for end of life, but eventually this out-of-hours GP said she was, so the care home said, "Right, you've got free, you can come and visit her." So for 3 days I saw my mum, and it was wonderful. It was horrible that she was in pain, but when she wasn't in pain, she was so happy to see me. And eventually the drugs just totally zonked her out. When they stopped the drugs and she started to come to, the GP came to review the end of life and then said she wasn't end of life. So visiting stopped. So more torture. So I started arguing with them about end of life. And then the council, their guidance says end of life is the last couple of days. Well, no, it's not. For somebody with dementia, end of life can be the last year. And for somebody like my mum with an aneurysm, that could burst at any time. So you can't say she's not going to die in 2 days' time. But they wouldn't let me see her. We were then in tier 4. So according to the guidance, I could only have outside visits. So in the snow, I was sat outside my mum's room for 20 minutes. They brought her bed to the window, but her eyes were shut again. So she slept through the whole 20 minutes. They tried to give me a microphone. I tried tapping on the window, but Mum couldn't hear me. So that happened twice, 2 visits, one in the snow, one in the rain, under an umbrella. And it's just torture. I can't describe how appalling it is for Mum to be so close distance-wise, yet I'm not allowed to be with her, to touch her, to be close to her. And knowing she's got this death sentence that could happen any minute, it's inhumane and barbaric. Those are the only words that come to mind when I talk about it. I asked so many different questions, so many different times to make things better, but the answer was always no. And they couldn't tell me why. If they could have told me why and there was a justifiable reason, then fine, but there was no justifiable reason. The fact I couldn't walk across the grass because I could kill somebody, that tells you how unjustifiable it was. In July, that's when I started going on Twitter and social media, because I was reaching the end of my tether. I couldn't get them to see sense, and it was starting to impact on my health. And when I have those video calls with my mum and she's sobbing, that was just so difficult. So I think I first met you in November. That's when things were really getting difficult, and for the first time I put a video of my mum sobbing out on Twitter, and the response I got was amazing, because it is horrific to see my mum crying because I'm not there is a killer. I didn't want to put the video out there, and seeing my mum like that out there, it doesn't feel right, but it was the only thing that started making a difference. People had to know what my mum was suffering, what she was going through. And so I started talking to various different media and filming things, and there were newspaper articles trying to fight what was going on. Why are people not knowing about it? Why isn't mainstream media shouting about this every day? So through Twitter, I found lots of groups, and it was reassuring in one way. It wasn't just my care home, my mum's care home. It was the majority of care homes that weren't letting relatives visit their loved ones. And over the time, there have been 150,000 deaths in care homes. The majority in care homes, some ended up in hospital, but they have died. Why isn't that headline news? 150,000 deaths. And the survivors, like my mum, they have deteriorated beyond recognition. Some families, they never saw their loved ones before they died. So they had a phone call to say they're dead. Some didn't even get in to see them. How they are coping with that, I cannot comprehend. I'm broken just through what I've had to see, and I've had some access with my mum, but probably only because I fought for that access. Some care homes have allowed access all this time. They have numerous relatives going in. They've been testing for months and months. They've not had cases of COVID. So if they can do it, why aren't NHS England using quality improvement methodology to introduce this into all care homes? Why is it not happening? Why are people just sitting back and letting our loved ones deteriorate in front of our eyes alone? Isolation kills, and they are dying alone in torment. There are so many families broken by not being able to see their loved ones, particularly before they've died and particularly as they are deteriorating. And that is heartbreaking. I got to such a stage that I have been having nightmares. I would wake up sobbing or crying or shouting out loud, and I'd be looking for something. I'd be looking on my phone, I'd be looking on my bedside table. I don't know what I'm looking for, but I've got to find something to help my mum, and I can't find it. And I am worried for my health. So I actually got a consultant psychiatrist referral because this wasn't normal. I shouldn't be doing this. I've been stressed before in the past, but never once have I been waking up screaming. So from what I gather, what I've gone through from last March, I suppose it's a form of PTSD. Because Mum is just 4 miles away, but I can't get to her. I'm having counselling now, and I hope it will help. At the moment, it's not. I haven't had enough counselling to make a difference. I'm not sleeping properly. I am just so tired, and I'm not focusing properly because every waking minute I'm thinking about my mum.